Welcome back, everyone. Let's get right into it. Today, we are unpacking a highly scrutinized area in the medical equipment and supply sector, affordability and pricing. We'll be looking specifically at the SASB standard metrics under the code HCMS 240A. Now, if you're involved in sustainability reporting, financial disclosures, or corporate strategy in the medtech space, you already know that pricing isn't just a sales conversation anymore. It's a major regulatory and sustainability focal point.
Just to quickly ground us, remember that back in August 2022, the International Sustainability Standards Board, the ISSB, which is part of the IFRS Foundation, took over the SASB standards. They maintain these standards to help companies disclose sustainability risks that actually impact cash flows and the cost of capital. So we're not talking about nice-to-have metrics here. These are essential financial disclosures.
And that brings us to the elephant in the room. How on earth do you transparently report pricing in a totally volatile healthcare market? For financial reporting pros, this is the ultimate puzzle. You're dealing with complex global supply chains, endless product lines, and intense regulatory scrutiny. But transparent pricing metrics are absolutely critical right now because they show investors whether your business model can actually survive extreme cost containment pressures while still delivering real health innovations.
Okay, let's run through our agenda for metrics 240A.2 and 240A.3. We've got 1. Navigating downward pricing pressures. 2. Disclosing product price information. 3. Pricing factors and confidentiality. 4. Calculating average list price. 5. Calculating average net price. And 6. The investor value proposition.
Section 1. Navigating downward pricing pressures.
The medical equipment industry is staring down some massive market forces pushing prices down. We're seeing super aggressive healthcare cost containment initiatives all over the globe. On top of that, hospitals, providers, and payers are consolidating, which means they now wield huge centralized purchasing power. And finally, when government-sponsored insurance programs get extended, they usually bring a strict regulatory emphasis on reducing overall healthcare costs. Put it all together, and medtech companies have to strategically navigate immense, non-stop downward pricing pressures.
Section 2. Disclosing product price information.
So, the standard offers some flexibility, but it absolutely demands transparency. You need to describe how you disclose price information for each product to your customers or to their agents. Practically speaking, this means stating whether you share a price range, a median price, or a typical price. And keep in mind, customers doesn't just mean a direct hospital buyer. It includes intermediaries like group purchasing organizations or GPOs and consultants negotiating for the end user. You really have to be clear about how these different players are seeing your pricing.
Section 3. Pricing factors and confidentiality.
When you're drafting these disclosures, you also have the option to discuss the specific factors that actually influence your pricing. 3 big variables to think about here. First, product volume. Obviously, bulk purchasing usually triggers discounts. Second, region, because different geopolitical and economic environments play a huge role. And third, facility type. A small rural clinic is probably looking at a very different pricing structure than a massive centralized research hospital. Explaining these variables adds brilliant context to your raw numbers, and honestly, it saves you from answering the exact same questions on every single earnings call.
Now, a really crucial point of compliance here revolves around purchasing agreement confidentiality clauses. Basically, these are the gag clauses that legally restrict healthcare providers from telling third parties what they paid for your products. Investors want to know how heavily you rely on them. If you're using them constantly, it makes signal a lack of pricing transparency in the market, which carries its own set of regulatory and reputational risks for sure.
Section 4. Calculating average list price. Let's look at the hard math.
To really grasp this metric, think of it as the price tag versus the receipt. The standard wants you to disclose the percentage change in both the list price, that's the initial price tag, and the net price, what's actually on the receipt after all the negotiations are done. We'll start by looking at the list price. The star of the show here is the percentage symbol. The standard doesn't ask for raw dollar amounts. It wants the annualized percentage change across your entire global product portfolio compared to the prior reporting period. This is vital because it normalizes your data. It shows the trend of your pricing strategy over time rather than getting everyone bogged down in the specific currency values of millions of individual medical devices. So, how do we actually calculate that list price? The standard specifies using the wholesale acquisition cost, or WAC. You calculate the revenue-weighted average WAC for the reporting period, and then you figure out the annualized percentage change of that figure compared to the previous period.
That revenue weighting part is absolutely key. It makes sure that a massive price hike on some tiny volume product doesn't artificially skew your whole portfolio's data.
Section 5. Calculating average net price. The net price is your reality check. It's calculated as that revenue-weighted average WAC minus all the rebates, discounts, and returns. So it represents the actual revenue your company recognizes. By comparing the annualized percentage change in the list price right against the annualized percentage change in this net price, stakeholders can clearly see exactly how much discounting and rebating you have to do to actually move products in this hyper-competitive market.
Now, the folks who made the standard know that presenting just a single global number can lack a bit of nuance. So they provide some additional reporting options to let you add context. You can break your data down by product type or by region. You can add a narrative discussing your pricing strategies for those different categories. And, very importantly, you can disclose comparative inflation data, using a trusted source for consumer price indices, of course, to show how your price changes stack up against broader economic inflation.
Section 6. The investor value proposition. Ultimately, it all comes down to a delicate balancing act. Fair pricing limits the negative impacts of all those cost containment pressures we talked about at the start, but even more importantly, it can unlock massive revenue opportunities by expanding access. Think about it. Companies that successfully balance affordable pricing with profitability can actually grow their market share among patient populations that might otherwise be totally priced out of seeking care. Lower margins per unit can be powerfully offset by a massive increase in volume. I want to leave you with this provocative thought as we wrap up today's explainer. Are your pricing metrics just numbers you crunch to satisfy a reporting requirement, or do they actually prove your strategy for long-term market access? By clearly disclosing how you share pricing, how often you rely on confidentiality clauses, and the real delta between your list and net prices, you aren't just reporting data. You are proving to investors that you have a robust, future-proofed strategic plan. Thanks so much for joining me today. Keep digging into those standards, and I'll catch you next time.